So hi everyone, I'm Sunny. Wow, that picture blown up does not look great, does it? I lead Deloitte's 𝐂𝐝𝐿 team. The 𝐂𝐝𝐿 team at Deloitte uses technology to remove clinical admin so clinicians can focus on what matters most, their patients. A bit about myself, I'm a medic by background. I spent most of my career in strategy and AI consulting, and just prior to Deloitte, I set up the first integrated care system in the NHS analytics function that there is, and ran that for a couple of years. There's unprecedented demand in the NHS and healthcare systems around the world. There's been a pandemic, we all know this, right? There's nothing new about that statement at all. What is new is it's relentless. Media article after media article, headline after headline, it is not stopping. We've got to do something, right? The healthcare systems around the world are falling down. And our workforce plays a critical part of that, the most critical part of that. The BMA, which is the Medical Association in the UK, anticipates the NHS has 50,000 doctors short. How are we going to solve that? Well, currently we're recruiting at a rate of 6,000 per year. We're losing about 5,000 a year to retirements, leavers, etc. If we factor in population, not demand per person, but just purely population growth, we need another 570 per year. Math's not too hard, 430 net positive a year. Anyone done the maths to figure out how long that's going to take? No one's that quick. 116 years. That's right, 116 years before we close that clinical gap. Now, I don't know about anyone else in this room, but I plan to be long retired on a beach, hopefully, if I'm still alive by that point in time. So how do we solve it? Well, look, clinical admin, it's massive, right? Research out there says 30% of a clinician's day is spent on admin. 30%. Funnily enough, 30% equals about 50,000 doctors. It's a nice coincidence. Let's make that real, right? 30%, what does that mean? In the UK, if we stopped 369 hospitals from working, that's 30%. Any doctors in the room? Yeah, quite a few. Do you have enough beds? No one has enough bed? 48,000 beds. 48,000 beds. For those who didn't put their hands up, there's not a doctor, let's make that real for everyone else. Imagine, for the last 4 months of every year, you just spent doing admin. That's all you did, just admin. For 4 months of your year. It's crazy, right? We've all seen this a million times. Demand and capacity, it's growing, it's getting bigger. This is where the solution lies, right? Clinical admin, how do we help? So what's really interesting about this graph is when you look at the NHS long-term plan, all of the activities and interventions are focused on reducing demand. Now, that's great. We need to reduce demand. That's really good for our patients, absolutely. But I have a fundamental flaw in it, which is we have tons of unmet demand, so we're never going to reduce the demand. So let's focus on capacity. Well, what are we doing on capacity? It's all about how do we rob Peter to pay Paul? How do we take that ambulance driver and stick him in the hospital? Or how do we go to overseas countries and take their clinicians? Because they've all obviously got abundance of clinicians everywhere around the world, right? It's not going to work. We need something else. And that's where technology can really play its part. And we have a real belief that technology could fill that 30% gap, right? And fill what we need going forward. Now you might think, oh, this Sunny chap, he's a lunatic. What the hell is he talking about? This is decades off. It's not. We've seen it already. And I'm going to just talk you through 2 quick case studies. 𝐂𝐝𝐿 referrals. So we developed a technology. It's an AI triage technology which triages GP referral letters. It takes the referral letter in and then automates what a consultant doctor would do. It takes a consultant about 5 minutes to read a referral letter. That's 200 doctors in the UK. 200 doctors. We could automate 40% of that. Right? That's amazing. Free up those doctors. We're already doing it. It's live in hospitals. It's working. What's really interesting though about this story isn't the clinical impact, which is I know what I'm talking about here, but it's the patient impact. What we saw when we did this is that with this global pandemic, doctors aren't getting to the backlog, they're not getting to read all these referral letters. But actually, the bot doesn't get tired. The bot works 24/7, 365 days a year. We're seeing referrals being triaged on a much greater pace. The most urgent get seen quicker. Number two, we're also seeing that we can standardize to clinical practice. There's lots of variation. When did you train? Where did you train? How long ago did you train? Where in the country do you practice? We can standardize to guidelines using AI and technology. And finally, what we also saw is the doctors had more time. And what that meant is they spent more time on their complex patients, more time on the patients that didn't need an outpatient appointment. Their rejection rates increased, which might sound like a negative, but think about that from a patient. You don't have an unnecessary outpatient appointment. You then get seen and treated by your GP with the advice of the specialist consultant quicker. It's better for everyone, right? I'll talk you through another example. We have a collaboration with a company called 𝐂𝐸𝐴-𝐚𝐡. 𝐂𝐸-𝐚𝐡 are the digital front door to primary care in the UK, and they've recently expanded to the secondary care. Now, I'm going to tell you a bit of a personal story. About 3 months ago, I had a thumb infection. And I took a snap on my phone, filled in the 𝐂𝐸-𝐚𝐡 form online, super busy at work. My colleagues were busy bugging me all day, didn't have time to go to the GP. Within about 3 hours, my GP sent me a text back saying, "Seen your 𝐂𝐸-𝐚𝐡, here's your antibiotics." The next day, through the post, my antibiotics arrived, all sorted, all treated. So just think about that for a second, right? As a patient, I didn't have to go in, take a day off, sit in a waiting room, waste a load of time doing all of this stuff, take out time from my day. From a doctor perspective, it took him 2 minutes. I know this because I actually phoned him a couple of days later, so I could tell you all exactly how long it took him. It took him 2 minutes to do that, versus a usual consultation, which would have took him 10 minutes plus whatever time to write the prescription and have all of that fun afterwards. And that's exactly where technology has its role to play. It's got to be that tool for clinicians. And what we found with e-consultations is actually you could divert 70% of e-consultations away from GPs and into less resource-intensive stuff. You can also get rid of 10% of the demand, like the story I told, because you can use the AI to go, yep, that needs a prescription, bang, send it off, and we're all good and we're all done here. And so I know, where do I want to land on this? Fundamentally, look, technology is here. We have a gap in workforce. We have to do something different. And technology is going to play a role in making that gap, solving that gap. And that's the message I'd like to leave you with. Any questions from the audience? Got one at the front.
Really interesting talk, Tommy. My question is, a lot of this is focused on the UK. How do you think you can visualize maybe a lot of our audience here in Malta or Germany?
Yeah, great question. If anyone who didn't hear that, is how do we apply this sort of technology to other countries abroad and make it more internationalized? Well, look, everyone we speak to, we're a global company, every country we speak to, the number one problem that comes up time and time again is there's not enough workforce, there's not enough clinicians, there's not enough doctors, there's not enough nurses, etc. We all have the same problems. Yes, we might have a different electronic patient record system. Yes, we might have to bring a custom integration and whatever. That's all technology problems. It's simple, it's easy. That's not the hard problem. The hard problem is to understand how the clinical pathway works. And that is an international problem, not a national problem. And therefore, this stuff really does go broader, global, and have that greater impact.
Hi, so I'm a GP in the UK. So my question would be, how do we get what you're doing into our practice?
We should talk afterwards. And absolutely, this is the thing, right? How do we start to proliferate this sort of technology at a much more scalable level is really important. It's a really important question, because at the moment, there's lots of, the clinicians all buy it in, but we need to have these conversations at that broader national level to do this stuff at a bigger scale, because that's where we're going to really see the impact in your day-to-day practice. So if anyone didn't hear that question, it was, does eConsult create more admin? Absolutely it does. Right? Absolutely it does. And the reason it does is because right now it's not set up in the most efficient way because we haven't maximized the technology. Like with all technology, any initial technology has inefficiencies in the way it starts. We don't get the, when Apple invented the iPhone, right, we all now used to iPhone 10, 11, 27, whatever number it is now, right? And that's amazing. Apple 1 had lots of flaws, which is fine. We accepted it at the time. And it's the same with healthcare technology. If you think about what eConsult does right now, there are some challenges, right? The GP has to do that triage, and actually a really good example is they triage a patient and they go, oh, I'm going to need a face-to-face appointment anyway. So they basically have had 2 consultations. Our AI is doing that for it. So it's saying, these are the e-consultations that you're going to need to see face-to-face. Don't read it, auto-booked, patient slot. These are the patients you can solve on an e-consultation. Solve it in 5 minutes, save yourself 5 minutes. So yes, there are inefficiencies, but you've got to bear with those sorts of technologies to then start to reap the benefits over the long term. I'm well over. So thank you very much. It's been a pleasure talking to you all.